Does amantadine reduce rigidity in Parkinson's? Have you ever wondered if amantadine can help with rigidity in Parkinson's disease? Parkinson's disease is a progressive neurological disorder that affects movement. One of the hallmark symptoms is rigidity, which is muscle stiffness that can make it hard to move freely. Amantadine is a medication that has been used in treating Parkinson's disease, and it has some interesting effects on motor symptoms. Clinical studies indicate that amantadine can lead to a modest but statistically significant improvement in rigidity for some patients. In one double-blind, placebo-controlled study, patients taking amantadine experienced about a 12% improvement in rigidity compared to those on a placebo. This improvement was noted to be relatively consistent over treatment periods that could last from weeks to several months. This suggests that for some individuals, amantadine may provide a beneficial effect on muscle stiffness associated with Parkinson's disease. However, it is important to note that the overall evidence regarding amantadine's effectiveness for rigidity is limited and not entirely conclusive. A systematic review has pointed out that there is insufficient high-quality evidence to fully confirm the safety and effectiveness of amantadine for all Parkinson's disease symptoms, including rigidity. Some patients may even develop resistance to the medication over time. Additionally, amantadine can cause side effects such as dry mouth, blurred vision, and psychiatric symptoms, which are important to consider. Interestingly, while amantadine does have some effect on rigidity, it is more commonly recognized for its role in reducing dyskinesias. Dyskinesias are involuntary movements that can occur as side effects of long-term treatment with levodopa, another common medication for Parkinson's disease. The anti-rigidity effect of amantadine is considered secondary and not as strong as its ability to manage dyskinesias. In summary, amantadine can reduce rigidity in Parkinson's disease to some extent, with evidence supporting modest improvements for certain patients. However, the strength of this effect can vary widely among individuals. Its primary clinical use is often focused on managing dyskinesias rather than rigidity alone. If you or someone you know is considering amantadine as part of a treatment plan, it is essential to consult healthcare professionals. They can help determine the appropriateness of this medication based on individual needs and potential risks.